Hey everyone, and welcome back to the deep dive. We always bring you the latest research, and today we're tackling a topic that's a little bit sensitive, but super important, especially for all you GPs out there.
Mm-hmm.
We're diving deep into sexual activity and heart health, specifically after those cardiac events.
Yeah.
I mean, think about it as GPs. You're on the front lines
Yeah.
dealing with these patients every day.
Right.
And it's not just about managing their physical recovery, right? It's
It's a
about their overall well-being.
Absolutely. And you hit the nail on the head.
Yeah.
It's about quality of life, and that includes intimacy.
Exactly. And let's be real for a second.
Okay.
This is a topic that can feel a bit awkward to bring up, both for us as clinicians and for our patients.
Oh, absolutely. There's definitely a stigma there,
Yeah,
and patients might be hesitant to ask those questions, even if they're worried sick.
exactly. They're probably sitting there thinking, can I even have sex again? Is it going to trigger another heart attack?
Exactly. And we need to remember that most patients actually want to talk about this.
Yeah.
They just need us to open the door.
That's such a good point.
Right.
So how do we do that? How do we make it less squirm-inducing for everyone involved?
Well, one way is to start by acknowledging the elephant in the room.
Okay,
You can say something like, I know this might be a sensitive topic, but I want to talk about your intimate life since your heart issue.
I like that. It's direct, but also empathetic.
Yeah. And remember, it's not just about asking the right questions.
Mm-hmm.
It's about creating a safe and non-judgmental space for them to share their concerns.
Absolutely. So we've talked about the elephant in the room, but what about the actual physical strain of sex?
Right.
I used to think of it as pretty low-key, like, reading a book or something.
Uh-huh. I wish.
But the research suggests otherwise. Right.
It's definitely more than just reading a book.
Okay.
Think more like a brisk walk, maybe cycling uphill or even dancing.
Oh, wow. Okay, so we're talking moderate exercise then.
Yes, studies have shown that sexual activity requires about 2 to 6 METs.
Just a reminder for our listeners, what are those again?
Oh, right. ME stands for metabolic equivalent of task.
Okay.
It's basically a measure of how much energy and activity it requires.
Got it. So 2 to 6 METs. That's actually a decent workout.
It is, and one study even measured couples' heart rates during sex, in the comfort of their own homes.
Wow, really?
Yeah, and the average peak heart rate was around 117 beats per minute.
Okay. That's higher than I expected. But is that heart rate inherently dangerous for most people?
That's a great question, and the answer is it depends.
Okay.
Our hearts race for all sorts of reasons throughout the day, right?
Yeah, think about running to catch the bus or,
Mm.
public speaking.
Exactly. And the same study actually found that the average heart rate during daily activities
Yeah.
was even higher, around 120 beats per minute.
So are we saying that sex is actually safer for the heart than, everyday life?
Well, it's not quite that simple.
Okay,
While the heart rate during sex might be lower than we think,
right.
we still need to consider individual risk factors and overall health status.
That makes sense.
Yeah.
So it's not a free pass, but it's also not as scary as some people might imagine.
Exactly. And I think that's a really important message for our patients.
Absolutely. Now let's talk about the elephant in the room, the big fear.
Okay.
Triggering another heart attack during sex. What are the actual chances of that happening?
The research shows that the absolute risk of a heart attack directly caused by sex is actually very low, around 1%.
That's reassuring to hear.
Yeah.
But I've heard a lot about absolute risk versus relative risk. Can you break that down for us?
Sure. Relative risk basically compares the likelihood of something happening in two groups.
Okay.
So studies show that the relative risk of a heart attack does increase after sex, but it's temporary,
Temporary meaning
lasting about 2 hours.
about it. So even if the relative risk goes up briefly,
Mm-hmm.
the actual chance of a heart attack from sex is still very small.
Exactly. One study found that only 0.9% of heart attack patients had been sexually active in the 2 hours before their event.
Okay, that puts things in perspective. So it's all about understanding the numbers and not letting fear take over.
Exactly. And remember that other everyday triggers like stress or anger might actually pose a higher overall risk simply because they happen more frequently.
That's a great point.
Yeah.
So how do we figure out who's at higher risk? What factors should GPs consider when advising patients about resuming sexual activity?
That's where risk stratification comes in.
Okay.
We need to consider things like their symptoms, disease severity, how recent their event was, and their exercise tolerance.
And speaking of exercise, can we use exercise testing to gauge someone's tolerance for sex? Given the similar physical demands?
That's a brilliant question, and it's actually something that's supported by research.
Okay.
If your patient can handle 4 to 6 METs on an exercise test.
Like brisk walking or climbing stairs.
Exactly. They're generally considered low risk for cardiac events during sex.
So if they can handle a few flights of stairs, they can probably handle a little bit of fun in the bedroom.
Haha,
I
exactly.
like that. I'm going to use that with my patients. And remember, folks, regular exercise not only benefits the heart,
Right.
but it can also improve sexual function.
It's a win-win.
It really is.
Yeah.
Now let's talk about something that I think is on a lot of patients' minds.
Okay.
Sexual dysfunction. I mean, it makes sense that a cardiac event could impact desire or ability, right?
Absolutely. It's actually more common than you might think.
Really, how common are we talking?
Studies show it can affect up to 75% of patients after a cardiac event.
Wow, 75%. That's huge. And I can only imagine the impact that has on their lives and relationships.
It's significant and it's often multifactorial.
Amazing.
There are both physical and psychological factors at play.
Okay, so let's break those down. What are some of the physical culprits?
Well, medication side effects can be a big one.
Mm-hmm.
Some heart meds like diuretics or beta blockers can contribute to ED in men, for example.
Right, I've had patients express those concerns before, worried that their meds will affect their sex lives.
It's a valid concern, and it's something we need to address openly and honestly.
Absolutely. And beyond meds, what else is going on physically?
Existing conditions like hypertension or diabetes also play a role.
So it's not just about the heart itself.
Right.
It's about all the things that come with heart disease.
Exactly. And then there are the psychological factors. Fear, anxiety, depression, all of these can impact desire and performance.
Makes sense. Imagine having a heart attack. It's natural to be anxious about any kind of stress on your heart, including sex.
Absolutely. And interestingly, women may experience an even greater decline in sexual activity after a heart attack compared to men.
That's interesting. Why do you think that is?
It could be due to a combination of factors, including hormonal changes, societal pressures, and even differences in how we perceive and treat heart attacks in women.
That's a really important point. So we've got this complex interplay of physical and psychological factors all contributing to sexual dysfunction.
Exactly. And it's crucial that we address both aspects.
Absolutely. Now let's
Yeah.
focus on a specific type of sexual dysfunction that's particularly common in men with CVD, erectile dysfunction or ED.
It's a sensitive topic, but one that we need to talk about openly and honestly.
I agree. So what are the main treatments for ED in these men?
Well, one of the most widely used and effective treatments is PDE5 inhibitors.
Like Viagra.
Exactly.
But I know there are also concerns about potential side effects, especially for men with heart conditions.
Absolutely. There are always risks and benefits to consider with any medication.
Right. So can you clarify those risks for us? Who should absolutely avoid these drugs?
The biggest red flag is combining PDE5 inhibitors with nitrates.
Okay.
That can cause a dangerous drop in blood pressure.
So if a patient is already on nitrates for their heart,
Mm-hmm.
they should steer clear of Viagra and similar drugs.
Absolutely. That's a hard no.
Okay, good
Good.
to know. And what about other antihypertensive medications? Are those safe to combine with PDE5 inhibitors?
Most of them are, but it's always essential to review their medication list carefully
Right.
and make sure there are no potential interactions.
So it's not just about prescribing a pill. It's about understanding the whole patient and their individual needs.
Exactly. Personalized medicine at its best.
This has been incredibly insightful so far. We've covered a lot of ground, but there's still so much more to explore.
Definitely.
So for those of you listening, stay tuned for part 2 of this deep dive into sexual activity and cardiovascular disease.
We'll delve deeper into managing risk, addressing dysfunction, and helping your patients lead fulfilling and intimate lives.
It's going to be good.
See you there?
See you then.
Welcome back to the deep dive. We're picking up right where we left off, talking about ED and those PDE5 inhibitors.
Right. Those are definitely a good first-line option for many men.
Mm-hmm. But what about those who can't take them, or maybe don't get the results they're hoping for?
Well, there are other treatments we can consider.
Okay, like what?
One option is alprostadil.
Elprostadil.
It's a medication that's injected directly into the penis.
Okay, I have to admit that sounds a little intense.
Yeah, it's not for everyone.
Yeah. Are there any downsides? Well, some men find the injections uncomfortable, and there's also a risk of priapism.
Priapism? That sounds serious.
It's basically a prolonged and painful erection.
Oh, yikes.
Yeah.
Okay, so maybe not the ideal solution for every patient.
Right. It's definitely something we need to discuss carefully with them, weighing the pros and cons.
Absolutely.
Yeah.
So what other alternatives are out there?
Well, there are also penile prostheses.
Those are the surgically implanted devices, right?
Exactly. They provide a more permanent solution, but of course, as with any surgery, there are potential risks and complications.
Right. So that's a pretty big decision.
It is, and it's not something we take lightly.
Okay, so we've got injections and implants. Anything else?
Don't forget about vacuum erection devices.
Oh, yeah, those use suction to help achieve an erection, right?
Exactly. They can be a good choice for men who want to avoid medication or surgery.
So it really comes down to finding the best fit for each individual patient.
Absolutely. Taking into account their preferences, their medical history, and their overall goals.
Makes sense. Now let's switch gears and talk about sexual dysfunction in women with CVD.
Okay.
This is an area where I feel like we need more research and more awareness.
You're right. It's often overlooked, but just as important.
Absolutely.
Yeah.
So what are some of the challenges women face?
Well, one common issue is vaginal dryness.
Okay, that makes sense, especially after menopause.
Right. And it can make sex painful.
Yeah, I can see how that would be a problem.
Fortunately, it's easily treatable with topical estrogen therapy.
Okay, so that's something we can definitely offer our patients.
Absolutely. And just like with men, addressing any underlying psychological issues like anxiety or depression is crucial.
Right, because those can definitely impact desire and arousal.
Exactly. Cognitive behavioral therapy can be really helpful in those cases.
So once again, it's a holistic approach considering both the physical and emotional components.
Exactly. We need to treat the whole person, not just the heart condition.
I love that. Now, we've talked a lot about the risks and challenges, but it's important to remember that intimacy is a fundamental human need.
Absolutely. It's about connection, pleasure, and overall well-being.
Exactly. So how can we help our patients reclaim this part of their lives without compromising their health?
I like to reframe the conversation instead of focusing on what they shouldn't do.
Okay.
Let's empower them to explore what they can do.
I love that approach. It's about possibilities, not limitations.
Exactly.
Yeah.
So, for example, encourage them to start slowly and gradually increase their activity level as they feel more comfortable.
Okay, so no need to jump right back into things.
Right. And remind them that foreplay and non-penetrative sexual activities can be just as fulfilling.
That's a great point. It's about rediscovering intimacy in all its forms.
And let's not forget the importance of setting the mood.
Oh yeah, ambiance is key.
Encourage them to create a relaxing and comfortable environment and communicate openly with their partners.
It's about taking the pressure off and focusing on the emotional connection.
Exactly. And don't forget, regular exercise can work wonders for both cardiovascular health and sexual function.
It's the ultimate win-win.
It really is.
Okay, so let's recap some key takeaways for our busy GP listeners.
Okay.
First and foremost, don't be afraid to discuss sexual health. Your patients are probably waiting for you to bring it up.
They are, and they'll appreciate your willingness to talk about it.
Absolutely.
Yeah.
Second, remember that the absolute risk of a heart attack triggered by sex is actually very low for most patients.
That's right. We don't want to unnecessarily scare them away from intimacy.
Third, exercise tolerance is a good indicator of sex tolerance.
If they can handle moderate physical activity, they can likely handle sex as well.
And of course, regular exercise benefits both heart health and sexual function.
It's a double whammy.
I love it. And finally, be prepared to discuss sexual dysfunction both in men and women.
There are various treatment options available, and it's about finding the best fit for each patient.
Exactly. And encourage open communication, patience, and a focus on intimacy in all its forms.
Couldn't have said it better myself.
This has been a truly eye-opening discussion.
I agree.
And we're not done yet. There's still more to unpack.
We've got one more part to go.
So stay tuned for part 3, where we'll delve into tailoring advice for patients with specific cardiovascular conditions.
And explore more resources to support their sexual health.
It's going to be good. See you there. Welcome back to the deep dive. All right, so we've covered the basics, but let's get practical.
Okay.
Let's say I've got a patient right in front of me worried about sex after a heart attack. What's my first step?
Well, the most important thing is reassurance and a clear timeline.
Okay.
For an uncomplicated heart attack, we usually recommend waiting at least a week before resuming sexual activity.
A week. Okay, that gives their heart some time to heal.
Exactly. And even then, we need to assess their overall condition. Can they handle a brisk walk without any issues?
So we're back to that exercise tolerance as a guide.
Precisely. If they're not there yet, they might need cardiac rehab before even thinking about sex.
Makes sense. Now, what about patients who've had procedures like PCI or CABG?
Good point. Those are different beasts altogether.
Right, more invasive. So I imagine the recovery time is longer?
You got it. For uncomplicated PCI, they can usually resume sex within a few days as long as everything's healing well.
Okay, but CABG, that's open heart surgery.
Yep, much bigger deal. We recommend waiting at least 6 to 8 weeks after CAB.
Wow. Okay, that's significant.
And of course, we need to make sure that sternotomy incision is fully healed.
Right, no jumping the gun.
Yeah,
So it's all about giving their body ample time to recover.
absolutely. Now let's talk about stable angina.
Okay, those patients are already dealing with chest pain from exertion. So I imagine sex feels pretty risky.
It's a valid concern, but remember, stable angina means the pain is predictable.
Right.
The key is optimizing their medical management. Are they on the right meds? Can they exercise without triggering angina?
So if they can handle a treadmill test without chest pain.
Mm-hmm. They can probably handle sex too.
Okay, that makes sense. It's not about forbidding intimacy, it's about managing their condition effectively.
Exactly. And if sex does trigger angina, we can adjust their meds or talk about strategies like taking nitroglycerin beforehand.
Good to know. What about heart failure patients? That seems particularly tricky.
It is. We need to find that sweet spot between supporting their quality of life and protecting their health.
Right, so how do we assess their readiness for sex?
It all comes down to their functional capacity. Those with mild heart failure, NYHA class 1 or 2, can usually handle sex without major problems.
For those with more severe heart failure,
If they get winded just walking across the room, then sex is probably off the table for now.
makes sense their heart failure needs to be under control first.
Exactly. Now, another group that often raises concerns is patients with arrhythmias, especially those with pacemakers or ICDs.
Oh yeah, that's got to be nerve-wracking.
It is, but the good news is for most patients with these devices implanted for primary prevention.
Meaning they haven't had a life-threatening arrhythmia.
Exactly. Sex is generally safe.
Okay, so their devices are unlikely to go haywire during intimacy.
Right. But if they've had multiple shocks from their ICD, then we need to be much more cautious.
So again, it's about individualizing the advice.
Absolutely. And regardless of their specific condition, we always emphasize that they should stop and seek medical attention if they experience any concerning symptoms.
Like chest pain, dizziness, irregular heartbeat.
Exactly. We want them to be aware of their bodies and prioritize their safety.
Absolutely. Now, before we wrap up, I think it's crucial to connect our patients with additional resources.
Great point. We can't be experts on everything.
So where can we direct them?
Well, cardiac rehab is a great starting point. They often address sexual health along with exercise and lifestyle.
Right. It's a structured environment with support from healthcare professionals.
Exactly. And there are also support groups specifically for heart patients and their partners.
I can imagine the peer support is invaluable.
Oh, absolutely. And for more complex cases, referral to a specialist is always an option.
Like a cardiologist specializing in sexual medicine or a sex therapist.
Exactly. And don't forget about reputable websites like the American Heart Association or the Heart Foundation.
They offer evidence-based information that patients can access easily.
Exactly. But at the end of the day, you as their GP are their trusted advisor.
Right.
By initiating the conversation, listening with empathy, and connecting them with the right resources, you're making a real difference.
That's a powerful message.
Yeah.
This has been an amazing deep dive. I feel so much more confident discussing this topic now.
I'm glad to hear that.
We've covered so much, from the cardiovascular demands of sex to risk assessment to managing dysfunction.
And tailoring advice for specific conditions.
The key takeaway for me is that we don't have to shy away from these conversations.
Right.
As GPs, we have a unique opportunity to support our patients' sexual health and well-being.
Absolutely. It's all part of holistic care.
Couldn't agree more. Thank you so much for joining us today. It's been an absolute pleasure.
The pleasure was all mine.
And to all our listeners, thanks for tuning in. We hope you found this deep dive informative and empowering.
We'll see you next time.
Remember, knowledge is power. The more we know, the better we can care for our patients. Until then, stay curious and keep learning.